Hi and welcome to another Facebook Live session. We have with us Dr. Parinita Gupta. Welcome, ma'am. We are going to talk about something that we all want to talk about, but we talk very less about. This is something that we are going to talk about as understanding childhood cancers. We are going to talk about the treatments, the symptoms, and all that we have to know and we should know about childhood cancers. Before we skip into the session, let me give you a quick glimpse of who Dr. Parinita Gupta is. Dr. Parinita Gupta is a senior consultant, pediatric oncology and hematology in American Oncology Institute, Hyderabad. She has completed her medical in Osmania Medical College and also has about 18 years of experience in this pediatric oncology and hematology. We should be getting all the information we need from her today. Starting into the session now, we want to know about what are the most common types of childhood cancers.
So before getting into that, actually people are not aware that children can get cancers. Although it is extremely rare, we have to understand that even children are liable to get cancers. So but fortunately it is very rare. So if there are 100 patients affected with cancer, you will find one of them being a child. And most common type of childhood cancers are usually blood cancers, followed by other solid cancers that can occur in the abdomen, brain, and other parts of the body.
Are there any common risk factors among children for getting cancer?
Yeah, it's a good question. We talk about risk factors in lot of it in adults, but in children, there are not any risk factors that we usually see. Having said that, more than 95% of the children who get cancers, there are no identifiable risk factors. In about 5%, they usually have some genetic predisposition syndromes, which can actually predispose these kids to cancer. And we usually know about that before this cancer is detected, like, for example, Down syndrome and DNA repair disorders, etc.
Okay, but considering they're kids, parents are always a little more concerned about it. So is there anything that parents can do to prevent cancers among children?
Yeah, if we know the cause, then we can prevent. So because we don't know the cause, extensive research is being done in this area and hopefully we'll find something in future. But as of now, we don't have a cause for childhood cancer, a known cause as of now. So there are no preventative measures for preventing childhood cancers as such.
Okay, so when it comes to kids again, parents are a little extra concerned about them. So every little warning or symptoms that we can be reached out with. So what do you think are the basic early warnings and symptoms that the parents should be aware of so that they can be detected early?
Yeah. So usually cancer symptoms in children can be very non-specific. So what I would say is one big takeaway from this session is that any symptom that doesn't go away in reasonable amount of time is something that we have to evaluate. That means you need to get further advice on these symptoms. For example, if the child is having fever, prolonged periods of fever, normally we expect the fevers to go away in a few days' time. But if the fevers are going on for days and weeks, then that can be a symptom of cancer. Then excessive tiredness, fatigue, listlessness, irritability. And going to specific types of cancers which we have to detect early, and most of them we have to, one of them is a brain tumors where the symptoms can be very specific. Like if the child is having persistent headaches, usually children don't complain about headaches, especially the younger children. If they're having persistent headaches and they've come to you with complaints of headache, not once but few times, and then persistent vomitings or a new onset squint, these are the symptoms that you have to take seriously and see a doctor immediately. And usually the first point of contact would be your pediatrician.
Okay, so how are the cancers diagnosed among children?
Yeah. So if usually these children go to their pediatricians as a first point of call. And if the pediatrician thinks that these symptoms are actually suspicious, that's when they come to us. So usually for even general pediatricians or generally for people to know that is that any symptom that doesn't go away, you go and see your doctor. And if there's any abnormality on the initial evaluation that the pediatrician runs usually by some form of blood tests, usually blood counts, and basic scans. If there is a suspicion, then they usually come to us. So the evaluation usually is by blood tests and scans, sometimes with a bone marrow test. That is, we look at the bone marrow under the microscope. And then a few specialized scans are involved, like CT scan, MRI, PET-CT. And a biopsy. Suppose there is any solid tumor somewhere, any lesion that is suspicious, we usually do a biopsy, that is, take out a piece of the tissue and look at it under the microscope.
So what are the available treatment options that we have for preventing and curing childhood cancer?
So one good news is that, the first good news is that children's cancers are extremely rare, but we need to be aware of that. The second good news is that even if a child is affected with cancer, they are highly curable. Most of the cancers are highly curable, and for that we need to detect early, and if it is a lower stage, they are very curable, and some of the even advanced stage cancers in children, unlike adults, are highly curable. So we need to remember that and start from there as a starting point with lot of hope. And usual treatment options available in children are medical treatments, which is called chemotherapy. And sometimes we go for radiotherapy, that is radiation treatment, which we try and avoid, but only if that particular type of cancer warrants radiotherapy, we use it. And the other common treatment modality that we use is surgery. If there is any solid tumor somewhere or a lesion, then we usually try and shrink it with medical treatments, usually, and then remove it with surgery, followed by more medical options, depending on the type of cancers. And if handled well, usually children cope with these treatments very well, and also the outcomes are good if handled in by an expert team in a good, well-established pediatric cancer centers. And the caveat here is it's important that children get care in a child-focused centers. And throughout the world, the research has shown that results are better if children are treated in children's units.
Are there any complementary treatments that are given along with that, what you've mentioned previously, for childhood cancers?
Usually, little is known about complementary treatments, such as alternative treatments, if we look at it. We don't know much about that because they're little researched. But in addition to the treatment, family education is very, very important. If I might take it as a complementary treatment or supportive care, they need to understand what is happening. And infections are very common in India. Infective complications are the main cause of issues in children's cancer treatments. So parents need to be very aware about how to look after their children. Diet becomes a major issue. So we need to focus on the diet, and expert guidance is given on how to take your children through this tough times.
Understood. So is there any complications or post the treatment, anything that the parents and the children should know, or what are the side effects that can happen after the treatment? Yeah.
So there are immediate side effects which can be handled, most common of which is infectious complications that I have mentioned about. And there are a lot of infection control precautions that we need to take, all of us as a team and the family. And post-treatments also, depending on the type of treatment that the child receives, there are certain side effects expected, and which are fortunately quite rare, but we need to look out for that. Because we're giving these treatments in growing children, we need to be aware that these side effects can happen, mostly related to growth and endocrine hormonal issues, pubertal issues, and also school performance, because learning difficulties can happen because of two reasons. One is because we take them out of school for this amount of period of time, and they have missed that amount of normalcy in childhood. And also that some of these treatments can have an impact on their social issues because of the treatment and because of the type of treatments we give. So we do look out for these kind of things, and then if there is any suspicion, we have to refer to adequate assessments and therapies.
Although you have given us all the treatment options, everything, But is there anything that the parents can do for the children as a part of the emotional support?
Yes, emotional support is extremely important, and usually the child takes it from the family. And some of the older children need counseling, and that has to be taken up widely. Although there's a lot of stigma around it, we should not feel about it in that way. And I actively encourage our parents and children to take counseling, because this is a tremendous rough period that they're going through in their life. And for parents also, they need counseling. Most of them, I would say all of them, need some sort of counseling or the other to actually understand the issue and how to deal with it in a better way. And it all makes it much better. And more than that, this is an emotional part of it. Then the finances come into play. That also we need social workers, and they need to, hold their hand in helping them raise that amount of money and, find resources to complete the treatment.
I was actually about to get to that part next. So, apart from whatever we have discussed, what are the support services that you advise or prescribe for them, both the parents and the child, throughout their cancer journey?
Yeah. So what I've noticed is I've worked abroad and here. Abroad, there's no problem. Either they have insurance or there are a lot of, in England where I worked, we have free healthcare systems. But having come to India, there's a big gap, and there's a varied issues in the affordability of the families that I meet. And most of them are unaffordable. That is what actually really ties our hands down as clinicians, trying to help these children. We know that this child's cancer is curable, but then the financial part becomes very, very difficult. Knowing that your child has cancer is hard enough, and then you have to cope with the finances is another thing. So what we do is, usually any established pediatric cancer unit has some sort of financial assistance, some ways that have been figured out by the team. We usually go for other support services, and every family will be advised based on what they can afford and what they cannot. Then we advise them on how to raise funds. There are different sources of fundraising, from crowdfunding to NGOs which come forward, to PM relief funds and CM relief funds which can be taken up. And most of the children who come to us have been able to complete treatments with this kind of help.
Understood. I think we have covered almost all the topics that the viewers have to know: the treatment, the requisites, and the post part, the pre part, everything. But apart from whatever we have discussed about, is there any other one or two facts that you want the viewers to know, so that they are up and about when it comes to childhood cancers and the panic and the stigma that?
Yeah. First of all, I would say it's easy for me to say don't panic, but the good news is it is rare, and even if we end up with having a child with childhood cancer, most of them are highly curable. And one most important message I want to give is that if there is a symptom that doesn't go away, please go and see your doctor to clarify why that symptom is happening and why it is persistent. So that helps us in picking up these cancers early, which makes the cures much more easier and with less treatments.
Understood. I think we have every information that we need to know regarding childhood cancers. Thank you so much for taking your time and addressing the taboo, so that everybody can talk about it and they can come up and say and can believe that childhood cancers are curable. So we'll see you again in the next Facebook Live session. We'll keep addressing all the taboos and we'll keep curing cancer.